All right, it's getting ready. Have you ever decided on a restaurant based on the influence of other customers? Based on reviews from Yelp, TripAdvisor, Google, Foursquare, Facebook, or Twitter? What about your selection process for healthcare? This discussion is an overview of the Hospital Consumer Assessment of Healthcare Providers and Systems, also known as HCAHPS. Our discussion today is an overview of development, testing, and endorsing, HCAHPS content and administration, public reporting, measures and adjustments, and final remarks and resources. HCAHPS serves as the first nationally standardized method for collecting and publicly reporting patient experiences, which allows for consumer comparisons. Because Medicare requires that hospitals collect and report data in order to receive their full annual payment update, HCAHPS has quickly become the national standard for assessing patient experiences with hospital care. The HCAHPS survey is administered to samples of medical, surgical, and obstetric patients. It measures 9 key aspects of care quality, which will be covered later in the presentation. HCAHPS places particular value on the consistency of care by using a frequency scale to measure the consistency of patient experiences. In our next section, Nazreen will cover development, testing, and endorsement.
In 2002, Centers for Medicare and Medicaid Services partnered with the Agency for Healthcare Research and Quality, AHRQ, which is another federal agency to develop and test the HCAHPS survey. AHRQ carried out a rigorous, multifaceted scientific process, including public call for measures, literature review, cognitive interviews, consumer focus groups, stakeholder input, a 3-state pilot test, extensive psychometric analysis, consumer testing, and numerous small-scale field tests. CMS provided 3 separate opportunities for the public to comment on HCAHPS and responded to over 1,000 comments. In May of 2005, HCAHPS survey was endorsed by the National Quality Forum, which is a national organization that represents many healthcare providers, consumer groups, professional associations, federal agencies, and research organizations. In December of 2005, the Federal Office of Management and Budget gave its final approval for the national implementation of HCAHPS for public reporting purposes. CMS implemented HCAHPS in October of 2006, and the first public reporting results occurred in March of 2008. The survey and the results it produces are in the public domain. Hospitals implement HCAHPS under the Hospital Quality Alliance, which is a private-public partnership that includes major hospitals, consumer groups, accrediting bodies, government, and other groups that share an interest in improving the quality of health at hospitals. The enactment of the Deficit Reduction Act of 2005 has created additional incentive for acute care hospitals to participate in HCAHPS. Since 2007, hospitals that receive annual payment provision from the Inpatient Prospective Payment System, also known as IPPS, must collect and submit HCAHPS data to receive a payment. If they don't do so, they're subject to a 2% penalty. Non-IPPS hospitals, such as critical access hospitals, may voluntarily participate in HCAHPS. The Patient Protection and Affordable Care Act of 2010 includes HCAHPS among the measures to be used to calculate value-based incentive payments as of October 2012. In the first expansion of the survey since implementation, CMS has added 5 questions to the survey as of January 2013. 3 of those questions are about transition to post-hospital care, 1 question about admission through the ER, and 1 question about mental and emotional health. To discuss the survey further, I have Judy here.
The HCAHPS survey asked discharged patients 27 questions about their recent hospital stay. The survey contains 18 core questions about critical aspects of patients' hospital experiences. The 9 key aspects of care quality are communication with doctors, nurses, responsiveness to the hospital environment, quietness of the hospital environment, pain management, communication about medicines, discharge information, overall rating of hospital, and recommendation of the hospital. Included are 3 items to adjust for the mix of patients across hospitals and 2 items that support congressionally mandated. The HCAHPS survey is administered to a random sample of adult patients across medical conditions between 48 hours and 6 weeks after discharge. Responses otherwise indicated on the surveys are never, sometimes, usually, always. The following are some examples of questions. During the hospital stay, how often did nurses listen carefully to you? Another one is, during the hospital stay, how often did doctors explain things in a way you could understand? Now this one's about medication. Before giving you any new medication, how often did hospital staff describe possible side effects in a way you could understand? Another one would be, during the hospital stay, did you need medicine for pain? The survey is available in English, Spanish, Chinese, Russian, and Vietnamese in the mail format. HCAHPS can be implemented in the 4 different ways through the languages that I just discussed, and that can be done through the mail with telephone follow-up, or active interactive voice recognition, known as IVR. And another note on the languages, the telephone and the interactive voice recognition are only available in English and Spanish. All others can be done in the mail format. The actual wording of the HCAHPS questions and response categories, as well as scripts for conducting the survey in the telephone and interactive voice response modes, can be found under the survey instruments on the HCAHPS website. Hospitals must survey patients throughout each month of the year. Ayla will now review the reporting process.
The first public reporting of HCAHPS began in March 2008, when 2,421 hospitals reported scores based on 1.1 million surveys done, and it's been growing since then. In July 2013, 3,928 hospitals reported their HCAHPS scores based on 3.1 million surveys done. These surveys are done and reported 4 times every year on rolling basis. HCAHPS scores are based on the 4 most recent surveys. So every time the fresh survey comes in, the oldest one is rolled off as archive. And the 4 most recent ones are kept in place. These surveys are reported on Medicare Hospital Compare website, as shows on the link there. Hospital Compare has HCAHPS information and scores of 4,000 Medicare certified hospitals across the country. This is an interactive web page in which you can also choose to compare any 3 hospitals and also narrow down your search through different criteria. There's another website for the HCAHPS primarily, the link is up there. That site also compares the hospital surveys, summaries, analysis, national comparisons of all the current and historical HCAHPS scores and other surveys done. The reporting measures. HCAHPS results are reported publicly on Hospital Compare in form of 11 measures. And these measures are made from questions asked on the survey. These 11 measures are reported along with the state and national averages for comparison. These 11 measures consist of the composite topics, nursing communication, and you can see it's made of question number 1, 2, and 3. Doctor communication made of question number 4, 5, 6, and 7. Responsiveness of hospital staff, pain management, communication about medicines, discharge information, care transition. Then comes the individual items. That's made of question 8 and 9. It includes cleanliness of hospital environment, quietness of hospital environment, and then comes the global items, overall rating of hospitals, and willingness to recommend a hospital. Also, there's a new initiative to add 5-star quality ratings to all these measures in April 2015 to make it more easier for the consumers to compare the information. The HCAHPS adjustments. The HCAHPS surveys are not reported in raw form, and many adjustments are done before publishing it. These are the mode and patient mix adjustments. A research was done that it was determined that HCAHPS results vary among hospitals, and it depends on many factors which are beyond the hospital control. It varies based on mode of the survey done, whether it's collected through mail, telephone, mail combined with telephone follow-up, or active interactive voice system, that's IVR. Also, other factors affecting were the mix of patient on basis of age, education, and their self-rated health status. So to avoid bias, a calculation system was adopted to make post-survey adjustments, and then the scores were reported. Derek will now give the closing argument.
On average, it takes respondents approximately 7 minutes to complete the HCAHPS survey. The core set of HCAHPS questions can be combined with customized hospital-specific items to complement the data hospitals collect to support internal customer service and quality-related activities. In conclusion, the notable associations between measures of patient experiences, of care and technical quality and safety in hospitals suggest that HCAHPS measures are important new measures for hospital care quality, even though further study is needed to further investigate the relationships for improving hospital care. The presentation today has discussed a general overview of what HCAHPS is, development, testing, and endorsement, HCAHPS content and administration, public reporting measures and adjustments. As another resource, our textbook on pages 173 and 174 describes some of the questions more in detail. An additional source can be found online at the HCAHPS Hospital Survey landing page. For your information, there is a training registration now available, but the closing for it ends on February 19th. Provided are a list of the schedules for the days and times, morning and afternoon sessions, and the link to register is right here. In addition to those two sources online, We also used a journal article titled "The Relationship Between Patients' Perception of Care and Measures of Hospital Quality and Safety." Again, this is an overview of HCAHPS as it relates to measuring quality and performance.